So the well-awaited pregnancy has finally happened. Yes! And you went for your antenatal consults, and whilst the doctor was talking to you, he or she mentions that you have diabetes in pregnancy. After those words, everything was a blur. You're like, what does that mean for me and my baby? Well, don't panic. That is exactly what I'm going to address in this video. I will look at what diabetes is, but more specifically, I will hone in on diabetes in pregnancy. I will also look at the risk factors that makes a woman predisposed to developing diabetes in pregnancy, how you go about monitoring your blood sugar during pregnancy, and how you go about being tested properly to see whether or not you have gestational diabetes or you are at risk of developing gestational diabetes. And finally, I will address the implications of having gestational diabetes for you and your baby. Hi guys, welcome to Hey Doc with me, Dr. Katie. I'm a board certified family doctor. On this channel, we talk about women's health, fertility medicine, and we are now venturing into talking about all things to do with pregnancy. Once, thankfully, for some of you, you have now overcome the challenge of infertility. Right, diabetes in pregnancy. It's quite an important topic because, as I mentioned, it has significant implications both for your health long-term as well as short-term during the pregnancy, and the health of your baby whilst the baby is still in your womb and once the baby is delivered. We'll address that much later on in the video. But first of all, let's define what diabetes is. Diabetes occurs when the blood sugar levels become higher than normal because the body is not releasing enough of the hormone known as insulin, which is responsible for lowering our blood sugar. But this video is not just talking about diabetes in general, but rather diabetes specifically in pregnancy. So that said, diabetes in pregnancy refers to any form of diabetes that happens during a pregnancy. There are two main types of diabetes that can occur during pregnancy. The first is known as gestational diabetes. In this type of diabetes, the woman was not a diabetic prior to becoming pregnant, but she becomes diabetic during her pregnancy. And this form of diabetes quickly resolves after childbirth. So for these ladies, the first time they are ever told about the fact that they have a high blood sugar is during that pregnancy. Many of them have not had any health issues. As far as they're concerned, they have been fit and well up until that point. In this form of diabetes, the woman's pancreas, which is the organ that contains the cells that make the insulin hormone, is not able to produce enough insulin in response to the increased demand of pregnancy. Gestational diabetes is often diagnosed in the second or the third trimester. Now, remember I mentioned that gestational diabetes resolves after childbirth. The reason is because during pregnancy, the placenta produces hormones like human placental lactogen, estrogen, and cortisol, all of which support the baby's development. But these hormones also increase insulin resistance in the mother's body. Because insulin is responsible for regulating blood sugar by enabling the cells to absorb sugar from the bloodstream, as insulin resistance rises, the body has to be able to produce more insulin in order to keep the blood sugar stable. So after childbirth, once the placenta is removed, this hormonal shift that happened because of the presence of the placenta automatically normalizes once the placenta is gone. The second type of diabetes that occurs in pregnancy is pre-existing diabetes. And quite simply, all that means is that the woman that has fallen pregnant had diabetes before becoming pregnant. It may either be type 1 diabetes, and these patients would have developed diabetes when they were much younger. Type 1 diabetes is really seen as an autoimmune condition in which the body's own immune system attacks the cells within the pancreas that make insulin. And then there are those who have type 2 diabetes. This type of diabetes diabetes happens later on in life, and so these patients would have been given a diagnosis of diabetes when they are much older, in their 30s or even 40s. And in this type of diabetes, there is a combination of insulin resistance and a gradual decline in the number of cells that actually produce insulin with time. If you are a woman who has diabetes and you are looking to get pregnant, or you are thankfully already pregnant, there needs to have been a conversation between you and your doctor explaining the implications of falling pregnant with diabetes and the importance of you having a well-controlled blood sugar during your pregnancy. Why is this important? Well, because pre-existing diabetes puts you at an increased risk of experiencing complications in your pregnancy. And these complications vary from birth defects, increased risk of miscarriages, having preterm births, or even preeclampsia. Now, how do you know if you are someone who is likely to develop gestational diabetes when you become pregnant? Well, the first thing to know is that gestational diabetes is common. 4 to 5 out of 100 women will be diagnosed with gestational diabetes in their pregnancy. However, there are certain factors that make a woman at a greater risk of developing gestational diabetes in comparison to another lady. The first is having an increased body mass index, and we're usually looking at a BMI of 30 and over. Number 2 is if you were previously given birth to a baby weighing 4.5 kilograms or more. The third is if you previously had gestational diabetes. Number 4 is having a parent, a sister, or a brother with diabetes. And finally, your family origin does matter. Those of South Asian, Chinese, African, or Middle Eastern descent are at an increased risk of developing gestational diabetes. There is a specific way that your doctor should be checking you for gestational diabetes. If it's not done this way, the condition may be ruled out too early, or it may be diagnosed too late. If you have any of the previous risk factors that I've previously listed, you should be tested for gestational diabetes early on in your pregnancy. That means during that first antenatal visit, in and amongst the long list of blood tests that your doctor will be requesting for you should be a blood test checking for your HbA1c, which is your long-term control of your blood sugar over a 3-month period, as well as you doing an oral glucose tolerance test. So remember, you should be tested early. That means within your 8 to 10 week first antenatal visit, you should be tested for gestational diabetes at that stage, only if you have the risk factors that I have just listed. Important to reiterate. Now, it is important to mention that all women, irrespective of whether or not they have these risk factors, should be tested for gestational diabetes. However, if you do not have any of the risk factors listed that make you at risk of developing gestational diabetes, then you are fine to be tested for gestational diabetes for the first time at 26 weeks and again at 28 weeks. So do not let your doctor check you just once for gestational diabetes. It should be done twice at 26 weeks of gestation and 28 weeks of gestation. The way gestational diabetes can be tested properly is by doing an oral glucose tolerance test. This is a fasting test. That means that prior to doing this test, you needed to have abstained from any calorie-containing food or beverage for a minimum of 8 to 12 hours. So you can have water, black coffee, or black tea, but ideally just stick to water during those 8 to 12 hours. So when you get to the testing center, you are nice and fasted. The first thing that will happen is that you will have a blood test. Then you will be given a sugary beverage to consume. In most countries, women are given Lucozade, which is a high sugar containing beverage. An hour after consuming the beverage, you will have another blood test, checking for what your blood glucose levels are. Then again, 2 hours after consuming the beverage, you will have your third blood test. And basically what we're checking for is how your body has been able to respond to the sugar load that you had consumed a few hours prior. Just an important point to note for the ladies who had gestational diabetes in their previous pregnancies, who will be tested for gestational diabetes much earlier on in their pregnancy. Remember that you will still need to be tested for gestational diabetes at 26 and 28 weeks. So don't think that, oh, I was tested early on in a pregnancy, I don't need the test at 26 and 28 weeks. That would be a big mistake. So what does having gestational diabetes or even pre-existing diabetes mean for you and your baby? A lot of women who have gestational diabetes during their pregnancies end up having very healthy pregnancies and even healthier children. So it's not all doom and gloom if you're told that you have gestational diabetes during your pregnancy. Of course, you can definitely do without it. You can do without all the additional blood tests that you'll have to do if you are told that you have gestational diabetes. But most of the time, you are going to be fine. And for those of you who have pre-existing diabetes, you will be used to pricking yourself or going for regular blood checkups. And if you have pre-existing diabetes and you have been really good at keeping a good blood sugar level, then it's not going to be a big deal because you are good at keeping your blood sugar levels in check anyway. But occasionally, gestational diabetes can cause serious problems for both the mother and the baby, particularly when it is not recognized and treated early enough. Let's look at the risk of having gestational diabetes. Let's look at the risk to the baby first. The first concern is that you will have a bigger than average baby. That is known as macrosomia. Macrosomia can happen in gestational diabetes as well as women with pre-existing diabetes. Macrosomia leads to the next complication, which is birthing injury. And the main birthing injury that we're worried about in women who have diabetes in pregnancy is shoulder dystocia. So because these babies are so big, they get stuck in the birthing canal. That can happen with normal vaginal delivery as well as delivering the baby through a cesarean section. When the shoulders get stuck and the baby is having to be pulled by the head in order to be able to deliver the rest of the body, it causes injury to the brachial plexus, which is a group of nerve present within the neck and shoulder area. And these nerves are important for the sensation and the movement of the arm. So if there's injury to the brachial plexus simply because the baby was so large that it got stuck in the birthing canal or during the cesarean section because of the shoulder, the child may develop a palsy or a form of paralysis of an upper limb. There is a risk of having a stillbirth or the baby dying during or close to the birth. Although this is uncommon, in a small percentage of patients, this can be a sad complication of diabetes in pregnancy. Preterm birth is a common complication of diabetes in pregnancy, and these babies may have to spend a long while in the neonatal intensive care unit. Babies born to mothers with diabetes in pregnancy have a higher risk of developing hypoglycemia, which is a low blood sugar level after they are born. So often this will be another indication why these babies will need to be admitted to the neonatal intensive care unit. So what are the risks for you of having gestational diabetes during your pregnancy? The first is gestational hypertension. This is high blood pressure that is seen for the first time in this woman during her pregnancy. And women with diabetes in pregnancy also are at a risk of developing preeclampsia, which is a serious complication of having high blood pressure in pregnancy. Preeclampsia, particularly if it is not well managed, can lead to severe organ damage. And preeclampsia is a life-threatening condition if left untreated. An important complication for you of having gestational diabetes is that studies have shown that women who have gestational diabetes are at an increased risk of developing type 2 diabetes later on in life. Now, not only are they at an increased risk of developing type 2 diabetes many years down the line, but also their children are at an increased risk of developing type 2 diabetes. That is all I have for you for this video. I hope it's been helpful and that you have been empowered with the knowledge that you now have about diabetes in pregnancy and will be able to allow you to manage this condition better during your pregnancy or even avoid it if possible. Watch this space because I'm going to do a follow-up video on what you should eat if you've been given the diagnosis of gestational diabetes or if you have pre-existing diabetes and you fall pregnant. What should your diet include? I'm also going to do a separate video on how diabetes in pregnancy is managed. Until then, show us some love, smash the like button, do remember to subscribe before you leave, and indulge in watching the many videos that we've got right here on HeyDoc that looks at women's health, fertility medicine, and now pregnancy. We look forward to seeing you in our next video, and you know how it is on this channel.